Hello, and welcome to this week's episode of Medisodes. This week, we will be going through a very contemporary issue that costs our NHS billions of pounds: smoking. It's common knowledge that smoking poses a serious healthcare risk, but how serious? The UK spent more than £9 billion on tobacco products in the last financial year, and in 2019, 14.1% of adults were active smokers, which equates to a staggering 6.9 million people. It is common knowledge that smoking poses a health risk, but what exactly is this health risk? Smoking affects not only one part of the body, but the whole body, and there are some vital organs that are affected by it. To start off with, I'll hand over to Shrey, who will be discussing the effect of smoking on the heart.
So smoking has a severely detrimental effect on the heart and the wider circulatory system. So the addictive chemical in cigarettes is nicotine, and nicotine increases the heart rate and blood pressure of the person who's smoking. And this leads to hypertension. And as we know from previous video about cardiovascular disease, hypertension is a risk factor for cardiovascular disease and increases your risks of heart attacks and strokes. Also, there's carbon monoxide, which is a poisonous gas. Carbon monoxide prevents blood cells from carrying the oxygen by binding to the hemoglobin instead of oxygen. There's also tar, which can build up in the arteries and cause blockages, leading to heart attacks. When you smoke, the walls of your arteries become sticky due to the many chemicals within cigarettes. There are over 7,000 different chemicals within a cigarette, most of which are extremely harmful to you. And the damage to the walls causes plaques to build up, and these collect and absorb cholesterol and calcium ions and such like, causing a hardened structure which narrows the artery, causing hypertension and higher blood pressure. And this causes a positive feedback loop, leading to atherosclerosis, which we talked about in our cardiovascular disease video. The fatty buildup narrows the arteries, and if this artery becomes blocked, this can lead to a heart attack if it's in one of the coronary arteries, and it can lead to a stroke if this happens in the brain. So we can see that smoking has a huge effect upon the heart and the circulatory system, but its biggest effect comes in the lungs. Now on to Adrian to discuss this.
The primary function of the lungs is to oxygenate the blood, to provide all the body cells with the oxygen it needs for respiration and energy release. While all tobacco products pose health risks, those that need to be lit on fire to be used, like cigarettes, are especially damaging to the lungs. Each breath of cigarette smoke contains a mix of over 7,000 chemicals. When breathing this in, these chemicals are transferred into the bloodstream and so are transported around the rest of the body. Tobacco burns in most cigarettes most common by incomplete combustion, and so contains carbon monoxide. As Shrey has mentioned, this colourless, odourless gas is extremely toxic, reducing the blood's capacity to carry oxygen, which has a derogatory effect on the rest of the body's organs, most notably the brain. Cigarette smoke contains acrolein, also known as propanol. It is the simplest unsaturated aldehyde and is naturally present in the environment in small amounts. Acrolein, being unsaturated, contains double bonds. It's very reactive and has a high electrophility. This makes it react readily with biological nucleophiles, leading to changes in protein structure and a reduction in natural antioxidants. In the pulmonary cells, acrolein can affect intracellular stress enzymes, increase mucus secretion, and damage the airway epithelium. The tendency to react with the nucleophiles also means that acrolein may also change DNA structure. This means that increased acrolein intake due to smoking increases the risk of DNA mutations, and so increases the risk that lung cells start dividing uncontrollably, which leads to lung cancer. Statistically, 1 in 13 males and 1 in 15 females in the UK will be diagnosed with lung cancer in their lifetime. A staggering 79% of lung cancer cases in the UK are preventable, and 72% of all lung cancer cases in the UK are caused by smoking. The magnitude of this figure highlights just how damaging smoking is. Of course, it is not only the acrolein in cigarette smoke that causes lung cancer. Acrolein is found in all types of smoke, not only cigarette smoke, including the exhaust smoke of internal combustion engines. However, the direct inhalation of smoke from cigarettes makes the effect of acrolein much more impactful. The more scientists learn about the damaging effects of acrolein to the lungs, the better equipped they are to finding cures for the diseases that are caused in part by smoking. Acrolein is far from the only risk posed to the lungs from smoking, but it is a well understood one that hopefully means that optimized treatments are being developed. Tar is the partially combusted residue that is left over from burning tobacco and can build up on the inside lung linings of the airway. Tar in cigarette smoke paralyzes the cilia in the lungs and contributes to lung diseases. Tar also contains most of the carcinogenic chemicals found in cigarettes. The damage that tar does to a smoker's lungs is both biochemical and mechanical. The mechanical way in which tar damages the lung is that it coats the inner linings. This means that the cilia are damaged and blocked, and they are no longer able to move mucus up and out of the lungs as easily as before. This leads to a buildup of mucus, which reduces the inner lung surface area and narrows the airways, which in turn makes breathing more difficult for smokers. On a broader level, smoking destroys the small alveoli in the lungs. The alveoli are tiny air sacs that increase the internal surface area of the lungs to allow for a rate of diffusion sufficient to provide the body with all the oxygen it needs. If some of these alveoli are destroyed, then it means that the internal surface area of the lungs is reduced. This means that the rate of gas exchange is greatly reduced, which means that the blood contains less oxygen, which reduces the amount of energy that is available to the body cells. Damage to the alveoli is not natural, and alveoli do not grow back or recover from any damage. This means that smoking results in irreversible permanent lung damage. One specific condition that is caused as a direct result of this lung damage is emphysema. People with this condition often find themselves short of breath and are incapable of extended physical efforts. The severity of the symptoms depends completely on how damaged their lungs are, from very little to almost completely. Emphysema can never be cured, but it can be treated to relieve symptoms and slow the progression of the disease. One possible treatment is breathing in air that contains a greater than normal percentage of oxygen, which increases the rate of diffusion in the lungs by increasing the steepness of the concentration gradient. That is, increasing the difference in concentrations of oxygen between the lungs and the blood, so that the oxygen available moves into the blood faster. Inhalers are also a common treatment, with different types being prescribed to different people. There are several different types of inhaler that are used in the treatment of COPD. The first is short-acting bronchodilator inhalers. For most people, this is the first treatment that is used. Bronchodilators are medicines that make breathing easier by relaxing and widening the airways. There are two subtypes of inhaler within this category. These are beta-2 inhalers and antimuscarinic inhalers. These short-acting inhalers should be used when you feel breathless, up to a maximum of 4 times a day. There are also long-acting bronchodilator inhalers, which are taken regularly, but less often, because doses last for up to 12 hours at a time. Steroid inhalers can be used in more extreme cases of COPD, where the patient still feels breathless, even when using long-acting inhalers. These can be prescribed alongside the other inhalers. If the symptoms are not able to be controlled using inhaler treatment, tablets can be used. Theophylline tablets are a type of bronchodilator that reduces swelling in the airways by causing the lining muscle to relax, which helps increase the lung volume for the tracts are widened. Mucolytics are used if the patient is suffering from a persistent chesty cough, which is usually caused by the buildup of mucus. This buildup of mucus is due to tar building up and cilia not being able to work properly. Mucolytics make the phlegm thinner and help it flow easier. So, the effects of smoking on the whole body are extremely dangerous. It is clear that they can be uncontrollable and, in some cases, fatal. But what is the government and the NHS doing to try and reduce the rate of smoking? And for this, I'll hand over to Anupam.
So, as we've discussed already, smoking places a massive strain on the NHS and the government as a whole in the UK. And as a result of the litany of health problems it causes, successive UK governments have enacted policies that endeavour to reduce its prevalence. And as a result, the NHS has, for many years, offered free help to smokers who want to quit. One way they do this is by the smoke-free helpline that is open Monday to Friday, 9 a.m. to 8 a.m. and on weekends 11 a.m. to 4 p.m. They've also released a smoke-free app in recent years to partner alongside the helpline, available on both the iOS and Android app stores, and is designed to enable smokers to go smoke-free for 28 days, after which they claim that your chances of quitting are multiplied by 5. The NHS also partners with hundreds of local stop smoking services, either run by local NHS health providers or affiliated services that can all be found through the NHS website. The main treatment offered by the NHS and these stop smoking services are nicotine replacement therapies, or NRT. NRTs can be bought from pharmacies and some shops, but is also available on prescription from a doctor or NHS stop smoking service. They're available in a multitude of forms, such as skin patches, chewing gum, inhalers, tablets, oral strips, lozenges, nasal and mouth sprays. These all act in different ways, but all serve the same purpose of gently weaning the smoker off nicotine, the addictive substance within cigarettes. Patches, for example, release nicotine slowly over time. Some can be worn constantly, whereas some are taken off during the night. Inhalers, gum, and sprays act more quickly and help with the cravings people feel once they are trying to quit smoking. Strong evidence suggests that using a combination of NRT is far more effective than using a single product. And in most cases, the best way to use NRTs is to combine patches with faster acting forms. Treatment usually lasts 8 to 12 weeks before you gradually reduce doses and eventually stop as you're weaned off the nicotine. A wide range of people are able to access NRTs via prescription. For example, adults, children over the age of 12, and pregnant women are all recommended to use NRTs if they already smoke. However, they must follow the usage according to their doctor's medical guidelines. There can be small side effects as well, such as skin irritation from patches, irritation of nose, throat, and eyes when using sprays, insomnia, and dizziness and headaches. Another much more controversial way of being weaned off of nicotine and cigarettes in general is by using e-cigarettes, electronic devices that deliver nicotine in a vapor. This allows you to inhale the nicotine without any of the harmful effects of smoking, since it doesn't contain any tar, tobacco, or carbon monoxide, or any of the other carcinogens and toxic substances found in regular cigarettes. Research has found that e-cigarettes can help you give up smoking, and so the NHS does recommend them in certain cases. Certain stop smoking services, for example, will prescribe them, and 2 hospitals run by Sandwell and West Birmingham hospitals have opened vape shops in 2019 in conjunction with a ban on smoking. Public Health England also advises hospitals to let patients vape indoors and in hospital beds. However, according to the annual Smoke-Free GB survey, in May 2017, 26% of respondents thought that e-cigarettes were just as harmful as real cigarettes. In Wales as well, a bill was attempted to pass to ban e-cigarettes in public places. However, the bill eventually failed. Vaping currently is the most popular form of NRT. However, it is very controversial as to whether it's the correct way to wean people off cigarettes and whether it hasn't caused more damage, as people who didn't smoke before, which consists of 48% of e-cigarette users, may have started using them. Outside of the NHS, the government themselves do a lot to try and act against smoking. And in 2017, they unveiled a new tobacco control plan, targeted around 4 main themes to try and achieve a smoke-free generation. Firstly, they aim at prevention. They ensure that the effective operation of legislation, such as proxy purchasing and standardized packaging, which has anti-smoking advertising on the packets, is aimed to reduce the uptake of smoking by new, young people. And they also aim to help pregnant smokers to quit. This way, they can prevent the number of newborns being born with a nicotine addiction. Steps 2 and 3 in this plan include supporting smokers to quit via the NHS and via local services, as well as eliminating variations in smoking rates and trying to stop the excess smoking that is found in certain regions of the UK. And finally, they look at effective enforcement of all this. A lot of progress has been made by successive UK governments in the last 30 years. However, by maintaining high duty rates for tobacco products and also ensuring sanctions in place already are continued, is a large part of the plan moving forward to stop a regression back towards smoking. The UK government has also launched specific ad campaigns. For example, in 1998, a white paper on tobacco promised that 60 million would be spent over 3 years to set up smoking cessation services, and that these services would be backed by an advertising campaign. It was launched in 1999, and the initial £5 million media campaign comprised of posters and 6 weeks of television advertising. In total, the UK government and the NHS combined have spent millions in trying to stop people smoking, and this has produced a remarkable effect of reducing UK smoking more than any other country since anti-smoking advertising has begun. Now that we've looked at how the NHS and the UK government as a whole have tackled smoking, let's discuss more about this subject. And we'll begin with vaping, the controversial topic that I alluded to in my segment. Shrey, what are your thoughts about vaping and its concerns and also possible benefits for people trying to stop smoking?
So, I believe one of the misconceptions about vaping is that it's harmless or it's very low risk. So in vaping, you still inhale nicotine, but instead of as a smoke, you inhale it as a vapor. And this means it is less harmful than regular cigarettes because it doesn't contain tobacco or produce tar or contain carbon monoxide, which I mentioned are very harmful. But it's still addictive due to nicotine. And as I said, nicotine does lead to hypertension, which is extremely bad, and a risk factor for many diseases. And there's also still carcinogens in the vapor. And so, according to a 2019 YouGov poll, 3.6 million people are vapors, about 7.1%. So that's about half the smoking rate, and about 54% are ex-smokers, give or take. And although vaping's not covered by the smoke-free legislation of that covers cigarettes, they're still banned, and it's kind of been left to different organizations to judge. But for example, on TFL, it's completely banned on all TFL services, and there's restrictions on the ingredients that can go into vapes, such as coloring, caffeine, taurine. And the problem is, e-cigs have only been around since about 2007, so there's not been many long-term studies on on its effects, and it's also been seen as because it's seen as less harmful, it can sometimes be a gateway, maybe, for people who wouldn't want to smoke. Maybe they think, oh, e-cigs are the benefits of smoking without the drawbacks, but this is not true. However, on the other hand, I believe that it can help people who are smokers to help quit. So rather than transitioning from smoking to not smoking, it could be a kind of way to bring them down gradually and increase the chance of them quitting smoking in the long term. Although I think overall it's a bad thing.
So thank you, Shrey. That was an insight into the potential negatives of vaping and bust some common myths about them being the perfect solution to smoking. So considering the negatives of smoking and their dangerous impact on our health, do you think tobacco products should still be legal to sell?
I think that since we live in a democracy where free speech is rightly so supported and freedom to choose, I think that the banning of tobacco products or the criminalizing of people who purchase them would be something that would be very difficult to legislate and something that would go against a lot of other critical beliefs within our governmental system. At the same time, I think the focus should be on making sure people are aware of the choice that they're making, of the pros and cons, before they make the decision to purchase cigarettes or before they make the decision to become smokers. However, I don't think it is possible for us to completely deny them of the opportunity to do so, especially when it's already intrinsically built into parts of our culture.
I would agree with Anupam. It's similar to alcohol in a way that both these things are extremely harmful, but they're so ingrained in the culture that banning them would probably be worse because it become unregulated. And when it becomes unregulated, then that can lead to even worse consequences. And I believe there's still one of the pillars of medical ethics is patient autonomy. And we also have to consider that it's the patient's choice, or in this case, a person's choice to smoke, but they should also be aware that there's consequences to it, and we need to make sure that we should encourage people not to smoke, but we should not go about by banning it. I don't think that'd be a very effective strategy.
You both make good points about free will and the right to choose, and of course, because smoking, like alcohol, is a choice that you make and it impacts your own health rather than others as such. Of course, the side effects of smoking on others are there. Your choice is mainly impactful on yourself, and it's not like mobile phones while driving where you're posing a risk to other people. So I also agree that it's fair that people should have the free will to choose whether they want to buy tobacco products, even if it is strongly not recommended. But I did touch on at the start of the episode how much money it costs our NHS to treat smoking, and the NHS is already overloaded, and the number of patients continues to increase every day, with the number of doctors decreasing, and the number of medical school students not enough to replace those who are leaving the profession. So, do we think that people who need treatment because of should go through a penalty or a fine when they get their treatment, or should they be put down lower on the list than people who need the treatment, for example, for a genetic condition that's not in their control?
I think the problem with doing that is that smoking is a much bigger issue than it affects loads of people, and sometimes the idea in an ideal world they'd be informed about the risks of smoking, but many people, if you look at the profile of people who smoke, they come from lower income, maybe less privileged backgrounds, and they might also, that's probably going to contribute to ill health as well. And although we shouldn't celebrate people who smoke, we should still try and help them. And on top of all this is prevention is better than cure. But also that if you quit smoking, you can still increase your health benefits a lot. If you quit smoking for a year, you half your risk of a heart attack compared to a smoker. And it's worth doing that to prevent heart attacks, prevent strokes that you have to treat, because it wouldn't be fair to not treat them.
Yeah, I have to agree there with what Shrey said. If you're refusing treatment based on a choice someone's made, I think that again goes against a lot of the principles of the NHS in this country and just the way a lot of democracies and governments in general around the world tackle healthcare. Again, prevention is far better than the cure, and obviously refusing treatment for certain people just criminalizes them even more in the eyes of the law. And it could even turn into a slippery slope where if you're refusing treatment, then people who choose to smoke are refused even more things in wider society.
And also, you can then apply it to different conditions as well. Like if someone's obese, would you not allow them to be treated? Or if someone is an alcoholic, would you stop them? No, instead of trying to basically punish them, you should be trying to help them and to make them healthier rather than being so punitive in how you treat with them.
Yeah, I must say I agree with those points, and it is under recent times where the NHS has become under stress, where these sorts of questions have become raised. And these sorts of questions have been raised about prioritizing treatment. Because in some cases people haven't chosen, some people they have chosen to have the treatment. But of course a medical professional's job is to help the patient, regardless of whether it's their life choice or whether they're born with it. And sometimes they do need to make choices prioritized. For example, a transplant may be prioritized for a younger patient than an older patient.
In addition to the point you're making, as the NHS is under considerable stress, I think the solution to the problem wouldn't be to cut help to people who need it on the basis that they have supposedly done this to themselves, but instead to allow the NHS to have the resources they need to actually be able to care for everyone.
Yeah, by no means am I suggesting that it is ideal to refuse treatment or prioritize treatment to others. But where budget and equipment is constrained, then sometimes healthcare professionals may be forced to choose, and the grounds of that may be whether the person has chosen to do something that increases their risk of that disease. So, we've gone through the effects that smoking has on the body, the lungs, and the heart specifically. But I've also touched on the whole body, including the brain and the liver. It's obvious that smoking should be avoided at all costs. And if you are already a smoker, then stopping smoking has profound impacts on your health that are almost immediate and almost unseen elsewhere. I hope you enjoyed listening to this episode and hope you're a bit more informed about smoking and its effects on healthcare. Be sure to like, comment, and subscribe, and tune in next week for another episode.